Our project is on skin cancer prevention by Amber, Haley, Laura, Perla, and Marissa. Did you know the United States Surgeon General issued a report in July of 2014 calling skin cancer a public health crisis? And in the past 3 decades, more people have had skin cancer than all other cancers combined. So why is our skin important? The skin is the largest organ of our body. It protects internal organs from germs and injury, prevents losing too much water and other fluids, controls body temperature, and helps the body make vitamin D. So what is skin cancer? Skin cancer is the most common cancer in the United States, and 1 in 5 Americans will develop skin cancer in their lifetime. It is caused by overexposure to the sun and other sources of UV radiation. UV radiation damages skin cell DNA and causes an abnormal growth of mutated skin cells. There are 2 types of skin cancer. Skin cancer is named after the type of skin cell. Melanoma is caused by damaged melanocytes, which are pigment cells, and it accounts for 75% of skin cancer deaths. Non-melanoma cancer includes basal cell carcinoma, which is the most common skin cancer, and squamous cell carcinoma. Overall, non-melanoma is the most curable skin cancer.
What are the signs and symptoms? You should visit a dermatologist if there is a change in size, shape, or color of a mole, you are experiencing changes in skin sensation, or if there is a new skin growth or a sore that will not heal. It is important to know the ABCDE rule for melanoma. A represents asymmetry, meaning that half the mole does not match the other half. B represents border irregularity and occurs when edges of the mole are irregular, ragged, blurred, or notched. C represents color, and it is when the mole has discoloration. Differing shades of tan, brown, or black may be present, and sometimes patches of pink, red, blue, or white. D represents diameter for a mole larger than 6 millimeters, and E represents evolution, which is the change of a mole over time. What are the risk factors? Exposure to UV light is the main risk factor, followed by having fair skin, being able to easily sunburn, having light hair, light-colored eyes, personal or family history of skin cancer, 50 or more moles on the body or abnormal moles, immunosuppressive disease or treatments, and exposure to arsenic. So why is prevention important? Experiencing more than 5 blistering sunburns between the ages of 15 and 20 increases melanoma risk by 80% and increases non-melanoma skin cancer risk by 68%. Also, reducing exposure to UV radiation could prevent more than 3 million cases of skin cancer per year. Just by using sunscreen on a daily basis, you can reduce the incidence of melanoma in half.
How can I prevent it? You can prevent skin cancer by limiting UV light exposure, protecting your skin with clothing, using an SPF 30 sunscreen, and doing a self-examination or skin exam by a health professional. Slip on a shirt, slap on some sunscreen, slap on a hat, seek shade, and slide on your shades.
Slip, slop, slap, seek and slide, have fun outside, but don't get fried. Slip on a shirt, slop on sunscreen, slap on a hat, seek shade, slide on sunnies, simple as that. Slip, slop, slap, seek and slide, have fun outside, but don't get fried. Slip, slop, slap, seek and slide.
5 tips to applying sunscreen. 1. Use a sunscreen with an SPF of 30 or higher, is water resistant, and has a broad spectrum coverage, protecting you from UVA and UVB rays. 2. Apply sunscreen at least 15 minutes before sun exposure. 3. Apply the correct amount of sunscreen. The recommended amount is 1 ounce for the entire body. 4. Reapply every 2 hours or after swimming or towel drying. 5. Cover all exposed skin with sunscreen. Remember, Try to seek shade between 10 a.m. and 4 p.m. when the sun's rays are the strongest. Even when it is cloudy outside, you can still be exposed to strong UV rays.
How is skin cancer treated? Treatment is based on size, location, depth of penetration, and age and general health of patient. In general, an excisional biopsy will be examined under a microscope to determine if cancer cells are present. There are multiple treatments available. These include surgery, radiation, chemotherapy, immunotherapy, and photodynamic therapy. One type of surgery is called Mohs micrographic surgery. In this treatment, a specialist removes small cancerous sections in the skin. While the patient waits, frozen sections of these excised layer are mapped in detail and examined under a microscope. This procedure is done many times until the examined layer is cancer-free. In this type of treatment, the cosmetic result is usually good and it has a high cure rate of 94 through 99%. Cryosurgery uses liquid nitrogen to remove the cancer. After that, a scab forms and falls off. This surgery is used for small, shallow skin cancers, and even though this is really inexpensive treatment, the cure rate is lower. Radiation. In radiation, X-ray beams are used to destroy cancer cells. It is mostly used for tumors that are hard to treat surgically and in patients whose health is delicate, such as the elderly, and cure rates range from 85% through 95%. In chemotherapy, anti-cancer drugs are used to destroy cancer cells. Topical chemotherapy uses a cream to kill cancer on the top layer of the skin. Chemotherapy is also done through a drip into a vein used to treat metastatic cancer. Cost of care. Skin cancer treatment cost varies, depending on the size, type, and stage of skin cancer. Treatment for melanoma is more expensive. Treatment can range from $1,000 to $56,000 a year per person annual care. What organizations support skin cancer? Sun Safe San Diego is an organization founded by a 17-year-old named Matt Stone here in San Diego. This organization's mission is to spread awareness about sun safety, especially because skin cancer in California is rising as shown in the graph. Other skin cancer organizations include American Melanoma Foundation, which has a support group here in San Diego, American Academy of Dermatology, American Cancer Society, American Childhood Cancer Organization, Cancer Care Inc., Cancer Hope Network, Sun Safe San Diego. For more info on more resources, visit the site below.
Want to make a change? You can share your story at skincancer.org by filling out the Share Your Story survey. Make sure to tell other people about it too so they can contribute.